afternoon, everyone, and welcome. My name is Dr. Ron Bouffard. You've joined us today for navigating food sensitivities, allergies, and intolerances with functional medicine. If you have questions throughout this seminar, please put your questions in now I'm trying to make sure I get this correct, the Q&A section of at the bottom of your screen so that I can, at the end of this lecture, sort of be able to answer them. I do not answer the chats, so please don't chat to me that way. Otherwise, like I said, let's start this process and see what's going on. Again, I'm from Align Modern Health. Many of you probably already know or may have been to Aligned. I am a functional medicine provider, and we offer help in, what functional medicine is using food as nutrition to actually help to improve your wellness. Our practice are based on a lot of GI issues and autoimmune disorders. We're going to talk about GI or gastrointestinal issues today. We definitely deal with a lot of food sensitivities, bloating, constipation, fatigue, a lot of fertility, weight management, nutrition counseling. We have other modalities. We do have the chiropractic physical medicine with rehab, mainly for musculoskeletal conditions, structural imbalances, and trying to help you sort of be the best you can. We can help with, sciatica, arthritis, disc disease, and then we also work with a lot of athletes on improving your performance. On the same vein, the clinical massage therapy department also works on the structural components, but more on the soft tissue versus chiropractic with the structural components. And in the massage therapy, we work with a lot of people who have TMJ issues. That's temporomandibular joint, headaches and migraines, injury or post-recovery for strains and sprains of soft tissue. We do work with anxiety and stress, of course, because your muscles get tight during all these. Pre and post-pregnancy for assistance in really making sure that you're comfortable pre-pregnancy and post. And of course, we work with fibromyalgia. And the last modality is acupuncture, one of my favorite, because it's so esoteric. It's a little bit more Eastern medicine than Western medicine, but we deal with a lot of the same components on the functional medicine side by dealing with fatigue and sleeplessness. We definitely deal with stress and anxiety, hormonal balances. There's a lot of really interesting talk back between acupuncture and functional medicine, which I think is a really good adjunct when we work together. In this combination, we are considered an integrative medicine clinic because those of us who work there help to decide where we can best navigate you to get the best possible care. So if you are considering any kind of these practices, certainly think about coming to Aligned. A little bit about me. Again, Ron Bouffard. I am a diplomate of the American Clinical Board of Nutrition. I'm also a diplomate of the American Board of Chiropractic Internists. That just means that on top of just being a chiropractor, which I did that almost 28 years ago, I have gone back to school and did a national board and 300 course hours on nutrition specifically. And then on the chiropractic internist, that is the functional medicine side of the chiropractic arm. So not only do I know how to diagnose, which is what the chiropractic internist and functional medicine side is, but I can also use my nutrition background in helping you determine what foods are best for trying to get you sort of back to where you need to be. I also am active in the American Chiropractic Association. I am Director of Membership for the Council on Nutrition. I've been doing that for a year now. And prior to that, I was in the practice development realm. It's just a branch of the education side of teaching other diplomates in nutrition and as chiropractic internists how to continue their education. Of course, I work at Aligned out of 3 clinics: Logan Square, Wicker Park, and River North. But I'm one of several functional medicine providers. So wherever you are, we could probably work with you, whether we do it in person or whether we do it telemed. Now, before we get too far into the allergy and food situation, I just want to make sure that you understand functional medicine and clinical nutrition and sort of the broad understanding. So in functional medicine, we kind of look at there are many potential causes that can be the potential of what triggers a certain condition. And as you can see on the left side of this image, you see depression as being the condition. And in functional medicine, we recognize that it's not, our realm is not to say or suggest that we need to give you an antidepressant medication, which can change some of the neurotransmitter effects in your brain. We know that sometimes depression is just because you lack omega-3s. Omega-3 is a very anti-inflammatory nutritional supplement. Of course, you know it from, fish. There's been a ton of studies recently with how omega-3 really helps bring down the neuroinflammation that happens in the brain. There's a significant study going on right now in northern Chicago about post-traumatic stress disorder and using significantly high levels of omega-3 deficiency to help mitigate the damage caused by either post-traumatic stress disorder or from post-concussive injuries. Of course, low thyroid can be the cause of depression for a number of reasons. Simply as their body isn't working so great, your metabolism slows down. Vitamin D deficiency definitely can express your depression, pre-diabetes, too much antibiotic use. We'll find later on when we talk about the gut, you'll find that the antibiotic use can actually break down the microbiome of the intestine, which can then start an inflammatory process, creating inflammation throughout the system, which then crosses the blood-brain barrier and create this depression. When you look at the right side of this image, you can see that the one cause for causing many different conditions. So inflammation just happens to be one of the broader terms of things that we see in our clinic on all elements, arthritis specifically when we're talking with the physical medicine team. But clearly, if you have inflammation, it can beget arthritis. It can certainly create some of this depression. Inflammation is the basic source of heart disease because we're causing inflammation of the blood vessels predominantly. Inflammation can trigger diabetes, and then diabetes can trigger the inflammation. It's this kind of back and forth system when we really talk about diabetes. And of course, inflammation is sort of the precursor of what can ultimately trigger off cancer. So in the functional medicine and clinical nutrition world, we don't just happen to look at heart disease and think that there's only a couple of things that we can do. If we find that we can deal with the inflammation source and mitigate it, we might actually be able to mitigate the heart disease. And that's really the basis of what functional medicine is, understanding that there's more than one thing that can cause, and there's more than one cause that can create different conditions. So what's the difference between food allergies and food sensitivities? Because this is an important element to understand. We're going to talk about predominantly food sensitivity and how we relate to it in the functional medicine, but food allergies do exist. As you can see, in a food allergy perspective, the response is usually fairly immediate. So when we're talking about food allergy, we're talking about one side of your immune system that produces something called immunoglobulin E, and that really will cause a big histamine response. So people who have food allergies sometimes can mitigate them with something as low grade as an antihistamine. But for some people, the response can become so aggressive that it then creates more problems, and then they might need to have more treatment. It is potentially life-threatening, a food allergy, because as the condition starts to kind of roll and the histamine becomes worse, you might have swelling of your tongue, of your palate of your mouth, and causing difficulty to breathe, which can then cause wheezing, dizziness, and then you could pass out and could conceivably die. These are the people who need to have EpiPens along with them because epinephrine is necessary to counteract the histamine cascade that is happening. It is far less common than what food sensitivity certainly is, but you probably know people who have certainly food allergies very specifically versus a food sensitivity who do need to be very wary of what it is that they're eating, because again, a food allergy can be life-threatening. We've heard so much more recently about, peanut allergies, let's say in the last 10 years, especially with children. And now the Food and Drug Administration has created a way of trying to mitigate that by creating a desensitization to allergies. In this particular case, they're just taking a low amount of the peanut protein and injecting it into the children to start having a little immune response, to try to build up the immune response to stop the histamine production. Food sensitivities, on the other hand, completely different animal. For one thing, different immunoglobulin. Where food allergies were IgE, food sensitivities are IgG and IgA. Furthermore, it's not an immediate response. It can be delayed for up to 72 hours. Some of them happen pretty immediate, but oftentimes we might have like a skin reaction or even just more bowel irregularity that can go up to 3 days beyond it. So sometimes it's hard to really determine what you're sensitive to if it was something that you ate 2 or 3 days ago that you're now just getting some sort of response from. The difference with food sensitivities is it isn't life-threatening. There is no reason to be concerned about fatality. It's just going to create some unpleasant symptoms for us that we're going to have to figure out how to mitigate. They are more common than what the traditional food allergy is. Somewhere between 10 to 15% of the population certainly has some form of food sensitivity, potentially. And then, of course, the symptoms that you get from food sensitivities are definitely more GI, but it can also be skin and can be migrainous. So we're talking gas and bloating, constipation, or loose bowels. That's the irregular bowel movements. Brain fog, when I kind of alluded to it earlier, whenever we create inflammation in the gut, we can get inflammatory proteins in the system through your blood, ending up crossing the blood-brain barrier, causing some irritation of the brain. When that happens, we get this brain fog and sort of like perplexity with memory. Dermatitis is just really skin conditions. One of the more common things is people who come to see me and we talk about getting hives from unknown sources. Oftentimes we're concerned with the types of food that you might be eating that might be causing this. The other thing you need to know is that when you have a food sensitivity, because it is creating this aggressive immunologic response, an autoimmune issue is usually when your immune system gets triggered and then can't stop sort of attacking something of your own body, whether it's your thyroid and Hashimoto's or whether it's your joints and rheumatoid arthritis. So there are several potentials that inducing or having a food sensitivity, and you have say a condition like Hashimoto's or rheumatoid, you can actually exacerbate that condition or trigger the uprising of more of the symptoms. So it's something that we should probably identify and determine. So before we get into talking about food sensitivities, let's talk about how the digestive system really works. So the interesting thing about the digestive system is we're a hollow tube. So the inside of the digestive system is sort of like our skin on the outside. There is a barrier that allows for food that we're eating to stay sort of outside, the inner workings of our body. And it doesn't start getting into our system until it gets into the small intestine. So what you have to understand, digestion is really the breakdown of food. That happens all in the mouth and the salivary glands, which produce different enzymes to break down some of the food. That's the beginning stages. Then goes to our stomach, and our stomach is the next organ that actually breaks down the food. There's really no absorption happening in the stomach at all. It isn't until we get into the small intestine that we have the absorption. That is where the breakdown can occur when we start getting things that shouldn't be crossing into the bloodstream. Once that happens and once that's triggered, this is where the potential for inflammation could come from, and food can be the source of that inflammation. The digestive tract itself is a large surface area of more than a doubles tennis court. So there's a lot of potential areas for this to happen. So it's not as uncommon as you might think, simply because the surface that we're dealing with is large, and it is how we get all of our nutrients. the one last point that I want to make is that the majority of our immune system is in the gut. It's where we're getting most of the bugs and viruses, other than in the lungs that we breathe in. We ingest and take in all sorts of bacteria from the food we eat, from the soil that it's grown in. And it's there in our immune system, or in our gut, that our immune system has to sort out all of the business of what is good for us and what isn't. And the stuff that isn't good for us is just going to keep passing through until it gets into the large intestine and then out. So we have to realize that the small intestine is really the big machine that's determining what do we take in and what don't we take in. And when the problem is when something causes a breakdown in that particular area of our digestion, that's when we start to have more problems. Leaky gut is one of the terms that you've probably heard about. I just want to bring the attention of this little diagram on the left, because it kind of shows us exactly what we're describing when we're describing leaky gut. So just for context, I want you to recognize that these toxins and these bugs and this gluten that's all in here, this is all inside the intestines. This part, this is healthy cells, and with these little bulbous things here that are called microvilli of the intestines. This is all that surface area we were talking about, where all the absorption of nutrients can happen. We have these gap junctions that happen between these cells, and there's a certain process that happens when a protein from food that we want in our system, or a carbohydrate, or protein itself, needs to be triggered to say, hey, we need you to come into the bloodstream. We open up the gate, this channel opens up like a doorway and allows those proteins. That's how a good, healthy intestinal system works. We pick, here's a product we need. We need calcium, let's bring this in. We need zinc, let's bring this in. It all happens via these automatic chains that kind of have this open door, closed door system. When we have food, in this case, we're using gluten as one of the examples, that could be inflammatory to us. It actually causes the inflammation of your intestinal lining itself, which causes everything to kind of swell. And then that gap junction opens up and allows for the gluten protein to actually flow down into the bloodstream, along with some of these bugs and some of these toxins. So there's a possibility when we have a food that creates a sensitivity and causes this inflammation, that it can actually open up the space, and then we end up with a whole bunch of stuff that shouldn't be in our bloodstream. Immediately, we have an immune response. This is where those IgG and IgAs sort of come into play. And they're the things that say, oh, wait, we've got this, particle of broccoli here, and we should just have a carbohydrate, but it's actually broccoli protein. It's foreign to us. Let's create an immunologic response. The inflammation that you see is usually due to, again, this increased sensitivity. It can be from bugs, it can be from different toxins, or it can be from foods that you just are naturally sensitive to. It does create this immune activation, which again is the IgG and the IgA. This isn't something that we're supposed to have. And then ultimately, it can create irritation within the blood vessels. And when that happens, we have something called oxidative stress, where our body tries to soothe the irritation of the blood vessels by using, for example, LDL cholesterol as a way of dampening that irritation and response. But it does create a stiffening of the arteries, which is what our oxidative stress can be. When we have this increased permeability due to either food proteins or endotoxins from the bad bugs, it creates the inflammation and causes the breakdown of the barrier, and it can create this self-attack, as what they're calling it, which is autoimmunity. So what are the autoimmune scenarios that we're talking about? MS, systemic pain, chronic fatigue. You can get multiple food sensitivities because as these barriers become open, a lot more foods that you are eating are coming into play. So it can be very tricky. We have to be able to identify what's the cause of leaky gut. And there are several different things that can cause it. It's not always just food, but it is one of the things that we like to look at just to make sure that we can rule out. So what do we want to know about? Sort of, how does this all happen? So when it comes to autoimmunity, there's something called molecular mimicry. And the reason why we're talking about this is there are foods that mimic certain proteins of our bodies that when they come into our systems, and because they look very similar to a certain product of our body, it creates in this immunoglobulin response, and then it will attack that certain gland. For instance, when we're talking about cow's milk, it can actually potentially promote type 1 diabetes. Type 1 diabetes is an autoimmune response to your pancreatic cells. So cow's milk has a similar protein structure in the case of these amino acids that looks like pancreas tissue. So if you have a propensity, or if there is a significant history of type 1 diabetes and you are drinking more milk, you can actually trigger that response and then ultimately end up with type 1 diabetes. Our bodies aren't meant to drink cow's milk. Our bodies are meant to drink, human milk. And only until we're sort of out of that infancy stage, we are the only species that actually drinks milk beyond that. Gluten is probably the one that everybody hears about, simply because, this gluten-free fad has been going on now for at least 15 years. So let's just discuss a couple of things about gluten. It is a protein found in wheat, barley, and rye. Ironically, it is very, it also looks a lot like your thyroid. So if you have an autoimmune disorder of your thyroid called Hashimoto's thyroiditis and you eat gluten, you will trigger an immune response to the gluten, and it will start attacking your thyroid and then make your autoimmune condition worse. So when we talk with people with Hashimoto's, or even people with thyroid disease in general, we usually try to steer them away from using gluten as a main form of their carbohydrates, simply because it will just complicate your thyroid condition. Now, celiac disease, on the other hand, is literally an irritable bowel disease where your intestinal lining has an adverse reaction and breaks down because of its association with gluten. So this is very much a very specific disease. It is not a sensitivity. It literally causes damage to your tissue lining to the point where you will have malabsorption issues and certainly a lot of loose stool. When you have celiac disease, you also have to avoid gluten. Otherwise, you're just going to have a pretty miserable life and you're going to be inflamed a lot. And it's pretty critical. You really need to try to limit the amount of gluten that you actually introduce. I always tell all my celiac patients, you just need to avoid it. You should never really be introducing gluten into your diet because it's just harmful to your system. Your body doesn't know how to react to it other than causing more damage to your intestinal lining. The non-celiac gluten sensitivity is what more people probably relate to, and this is where the gluten-free fad has sort of come up and coming in the past 10 to 15 years. Celiac disease, by the way, in the general population is about 1 to 3%, whereas non-celiac gluten sensitivity is up to 13% of the population that's impacted. There's a lot of interesting studies out there about whether it makes a difference that if it's, wheat that is either antiquated, which is wheat that hasn't been genetically modified, versus genetically modified wheat. If you ever read the book Wheat Belly, this gentleman does sort of pretty good argument about what happened in America and how we have modified all the wheat that we grow for agricultural purposes, and of course we feed it to our cattle and to our chickens, and so the consequences is we're getting some of these proteins that the body doesn't recognize that create some of this non-celiac gluten sensitivity. And if the cows are eating it and then we're eating those cows, we're sort of getting that. So that's one of the theories behind why we've seen a little bit more increase of this non-celiac gluten sensitivity. With gluten, we can have, there are certain parts of the gluten proteins that can affect the brain. So the autism and schizophrenia, there are certain parts that can affect the thyroid, certain parts that can affect the liver. So we know that gluten as a whole, along with milk, is certainly problematic, which is why milk is here. So we're the only species that does drink other mammals' milk for one thing, and we're the only species that drinks milk after infancy. We do know that there are increased risk factors for some of these autoimmune diseases, celiac, type 1 diabetes, Crohn's, and MS, specifically from introduction of cow's milk early in life. This is not a given. Not everybody has this milk sensitivity. And just to be clear, to understand, when we're talking about milk in a sensitivity in like this response, we're talking about the protein of milk versus the lactose, which is the sugar of milk. Some people are lactose intolerant. That's a whole different animal. But we're talking about whey and casein of milk, which is two different types of milk proteins, and they can be inflammatory and create some of these factors. And then lastly, there's a whole subset of things that some of us have probably heard of, avoiding nightshades. So the tomatoes, the potatoes, the peppers, eggplant, those are the nightshades. They have a propensity of causing some breakdown again within the system just by causing inflammation. Lectins is all of the, mainly of the legume sort. The skins of most of the beans that we eat have this lectin in it, which again is inflammatory to our bodies and causes a breakdown of proteins. It's the way it allows our body to get more food into our system, but it can be very inflammatory. If any of you follow Dr. Gundry, he's the big lectin avoidance doctor. And I find his information interesting, but I don't think everybody is lectin resistant. So it's not something that I necessarily ascribe to 100%, but I do think that the information is there, and it does kind of lend to itself and realize that, if you just remove a lot of these inflammatory foods, we can reverse a lot of these chronic diseases. Food aquaporins is probably the one thing you have never really heard about. And aquaporins exist in sort of wet foods because that's what aquaporin is. It's a protein that allows for the water of things like spinach and tomatoes to actually get into your system. But by doing so, it breaks down the cell wall to do that. And when that happens, it can cause more inflammation. Not as common on the sensitivity list, although some of the tests that we do test for the nightshades, the lectins, and the food aquaporin. So when we see it in common, we usually then will help to teach you which groups of foods we're really talking about. So this comes up in my practice all the time. People are like, well, how can I figure out what I'm sensitive to? Can I do an elimination diet? You can. I don't find it to be very effective for a number of reasons, is that it's really hard to isolate foods. And as we already said from the beginning, if we're talking about a food sensitivity, it can take up to 3 days to provoke a response. So if you are trying to discern whether you have a sensitivity to strawberries, you have to eat them for 4 days with nothing else, and then determine, I have had no reaction. Great, I can bring strawberries into my diet. Then you start with the next thing. It can be very time consuming. It's really hard to do in general. When we get to this point, usually with working with people and determining food sensitivities, I usually just recommend if we do the testing, we can see in black and white what your body is responding to and what it isn't. And then we can make a much better determination of what we need to avoid. The provocation diets are just that exact opposite, where we're trying to bring foods in that cause the response. And of course, nobody really wants to be triggering, irritable bowel if you don't have to. So one of the companies that we uses this this particular panel. Is one of the panels I like to use for people who do come in to see me and who say that they are gluten sensitive. Because if you're gluten sensitive, there's a number of different parts of the protein that are very driven specific to certain reactions. For instance, these transglutaminases here, 2, 3, and 6, all have different markers to whether or not they actually affect the brain, whether they affect the liver, or whether they actually affect your gut. When we're talking about alpha gliadin deaminated, we know that this is a possibility of celiac, but you also need to have other markers involved. But you can have some of these particular proteomes that we're looking at here, or different proteins. The other thing you have to realize is that even though we just think it's a really simple, wheat and gluten and gliadin are the 3 things that we usually talk about, there are about 60 different wheat gluten proteomes that we could test. This test is the only one that I know that tests, the 15 or so that they're testing here. With relative assurity, I don't think there are any other tests that do any more than this. I do want to point out, like luteomorphin and prodinophin is really most notable in people who are more susceptible to having the brain crossing. So Alzheimer's, dementia, autism, they'll be much higher recognizing these particular proteins of the wheat. So some tests just do wheat, some just do gliadin, and some do gluten. If you just do that, you're only going to get 3 pieces of information when there's a lot more that you could possibly get. I do want to point out that the companies that we use for food sensitivity testing do use both the IgG and the IgA testing, and they test separately. And then they all do repeats on what gets tested positive to make sure that they actually get an assertive positive. So the good thing about the test we use is when we get a positive result, we know that it is as accurate as can be because it's been tested twice. And we are doing a lot more than just the standard IgG. This is both IgG and IgA. Now, if you are gluten sensitive and you know that, and you decide, well, I'm just going to eat gluten-free foods. Ironically, there are some cross-reactive foods that can affect you just as gluten can, because they're very similar. So just because you find yourself gluten sensitive, if you haven't done a cross-reactive test, you have no idea whether or not you are going to be reacting simply because you're also drinking cow's milk, or you're sensitive to whey or oats. These are all gliadin cross-reactive foods. Gliadin is one of the proteins of wheat that can make it more sensitive. So it's a lot more complicated than just, like I said, wheat, gluten, and gliadin. If you are eating stuff that, well, I'm gluten sensitive, now I'm going to eat more buckwheat, over consuming that can create another inflammatory response. So sometimes replacing the foods with something like quinoa or tapioca or potato or buckwheat can actually, after consuming it for a long time, can create that same sensitivity. And then there are very reactive foods. Eggs, for one, is one of those that you can easily get a reaction. And if you're eating wheat and it's the eggs that are actually causing the problem, you're going to have a response. So there's no pure way of really determining 100% what you might be sensitive to, but we can certainly dig deep enough to determine what things are showing up, creating an immunologic response, and then how best to sort of get them out of your system. It's sometimes not as easy as just doing one of those home tests. The companies that we use do an abundance of different foods. What you're seeing here is the 210 panel. It's one of the largest panels that we have. You'll notice that some of these foods that we're looking at, they look at the protein as it's raw and then as it's cooked. Because when you cook certain foods, you do change the way the protein looks. For eggs are probably the best example, because the albumin of the egg, when we crack it into our pan, is that clear liquid, and then when we add heat to it, it actually causes the protein to constrict, and then we end up with the white of the egg that's cooked, and it has a complete different profile. So if we're not testing accurately, if we're not testing everything, I've had this happen before. This particular company has a list of foods, and broccoli is on it, but raw is the only way that it is tested. And then they do a second part of it, which is cooked broccoli. And I had a person who had all this gut issue and was eating chicken and steamed broccoli every day. And he said, I don't really eat much else, and I'm still having all of this inflammation and intestinal problem. So we did the food sensitivities to see what he came up with. And he had a couple other things that he just wasn't really eating, but had eaten in the past. And then broccoli looked great, but he was still having the problem. And he said, well, let's do the second half of the test. And we did it. And lo and behold, cooked broccoli, he was super sensitive to. So it's a good example of where you can eat the raw broccoli, but couldn't eat the cooked broccoli. So there are some nuances that really have to be derived. It's, again, there's a lot of wiggle room, but if we're trying to see whether or not your gut is responding to foods and causing breakdown, this is one of the ways that we can sort of identify it. What you need to understand about food sensitivity as well is that when you have foods that you're sensitive to, it's usually causing a breakdown of your microbiome. The microbiome, of course, is what is your sort of your coat of armor, so to speak, of your intestinal lining. And so when you have food that you're sensitive to, or food that is not digested well from your stomach coming into your small intestine, it can actually cause damage to the microbiome, which then exposes the intestinal lining a little bit more. And the consequences is you'll have irritation and inflammation of the intestinal lining, and suddenly you'll start, again, the gap junctions become bigger and you have this leaky gut scenario. Another question people have for me is, well, I don't eat this food, so why is it on my list? And I'll say, well, it's because you're pretty sensitive to it. So good thing you don't eat it, because you can still have a reaction, an immunologic response to it. It doesn't necessarily mean that it is one of the things that is actually causing your your inflammation of your gut. What I will say is that there's a lot of people out there who eat the same thing over and over again. And the consequence is when you do that, if you have just a minor amount of inflammation that is brought on by eating a little bit of it, if you keep eating it over and over again, you can actually create a food sensitivity. And then if you're really sensitive to, say, something like wheat, and then you do have an issue that shows up, and let's say it's peanut butter, and you're like, oh my God, I eat peanut butter every single day. Well, you probably eat it with either a cracker or perhaps with bread. And if you're sensitive to the wheat, that's what triggers the immune response. And then because you're eating it with the peanut butter now shows up in your bloodstream, and that's not truly what's causing the inflammation, but because you're inflamed by the wheat and you just happen to be eating at the same time that you're eating the peanut butter, you're going to have this response. So again, there's a lot of nuances to how you have to figure this out. It's not so easy. It's one of the reasons why when people come to me asking specifically about, oh, I've done a home test. So I always worry myself about, I worry myself to the point of whether or not, if you don't have enough information to know where exactly you've got to go with it, it's going to be more difficult for you. And again, I'm stuck. So there's probably a ton of questions because this is not an easy topic to speak about. I will say it is something we definitely have. It's one of the main things that we have coming into our office. So I have a couple of questions in the Q&A, and if you have questions, I'm going to ask you to go ahead and put them in there. I do want to say, though, that thank you for joining us. If you need more information and we're not able to get to your questions, you can always call at any of the offices and try to get a free 15-minute consult with one of the FM providers, and they will help answer some of your questions to determine whether or not you're a good candidate. I do want to point out that we do accept most insurances in terms of functional medicine. It's usually Blue Cross and Aetna are the two that we particularly use. And then we do have a good competitive cash pricing as well. So if you do not have either Blue Cross or Aetna, there is still a way for you to be able to get into us because you can ask about the competitive rates. So just let me look here at some of these questions in the Q&A and see if I can get a good answer for you. All right, so I love that the first question I get was, one doctor I spoke with said that leaky gut doesn't exist. Do you know why some doctors don't believe in this? Well, I don't know why some doctors don't believe in this. I do know that there is a bias medically, although I think most medical doctors understand the difference between immunoglobulin G and immunoglobulin A. But when it comes to the repair of the gut, in most situations, we're going to be looking at doing something like giving you an antacid or waiting until something becomes a problem and then either thinking about a surgery or something more invasive. It is one of the reasons people come to see functional medicine doctors, because we will do the testing that most other doctors won't. Will the test be covered by insurance? What's the time frame of the results of the test? Great question. So most of the food sensitivity tests are not covered by insurance because they're specialty testing that go beyond what most insurances are willing to cover. It again has that bias scenario. The time frame of the turnaround of the test is about 10 to 14 business days. It is a blood test, by the way, non-fasting. You just go in, we literally will draw blood. They'll take the proteins of all these different foods that you want to test, subject it to your blood, and see whether or not you will actually, have a reaction to it. So the next question is, who shouldn't drink celery juice? Isn't it true that people who take medicine, which said avoid grape juice, should also avoid celery juice? So, I'm not sure. So celery juice is used as a great detoxifier. Let's just say that. Is there anybody who really shouldn't be drinking celery juice, unless you shouldn't be eating celery, which is actually a pretty hearty, very low responsive food? Probably not a problem. Now, I'm not terribly sure about avoiding the grape juice, other than grape juice is just a bunch of sugar, and sugar is never really good for a number of inflammatory responses, for candida, for a lot of bugs. A lot of things just love the sugar, so avoiding the grape juice is probably a good idea. I have gluten sensitivity in the US. I recently moved to London and not experienced the same gluten sensitivity. When do you eat gluten here? It's quite remarkable. I keep waiting to have the reaction, but so far the past 3 months, not had an issue. Thank you for bringing that up. I mentioned this to every one of my patients who's going abroad. Europe has outlawed genetically modifying foods, and is probably one of the reasons why you don't have a gluten sensitivity, because most of us are sensitive to the modified gluten. Can food sensitivities be reversed? Are they permanent? Awesome question. So if you're sensitive to a food, you're sensitive to a food. The same way, like, if you're sensitive to tree pollen, you're going to have a response. Can you outgrow it? Exposures, yes. Minimizing the exposure is probably the best way. It's the idea behind food sensitivity testing is to determine what foods you should be specifically avoiding. And then when we do test, if we find there are foods that you're severely reactive to, it's simply because you've got a very overreactive response and you've got a very leaky gut. And the concern now is, if we sort of seal off the gut and heal it, we can then determine which foods you're truly sensitive towards. We'll find usually that if you have this large panel of things that show up, we'll ultimately end up with, nope, we actually don't, we don't have nearly that much. We've been able to sort of seal that response. Are you aware of a correlation between celiac and ulcers development? So, well, of course, celiac will cause damage to the intestinal lining. So if you're talking about ulcers of the stomach, I'm not aware of that correlation. Ulcers of the stomach usually are from a couple of different things, either an increase of hydrochloric acid due to stress, or it can be something called H. pylori. So I'm not aware that there's a specific correlation between ulcers of the stomach and celiac. I don't know if that was your question. Do you suggest a stool test to go along with food sensitivity test to get a full picture? Not always. So when I work with people, I usually want to know whether or not you have had exposure, and if your blood test does not show that there's any immunologic response going on, the guess is that there's nothing immunologic going on in your gut, and the only thing you're responding to is foods. So if your provider, thank you, Joni, if your provider is looking at your blood and sees that, yep, there's really no infection going on, there's no reason to do a stool test, particularly at this point in time. I have a food sensitivity to garlic powder, salt, and onion powder. Salt, they have no sensitivity to natural garlic or onions. What's that all about? Well, it's probably one of the additives that actually make it stabilized. So this is another really interesting scenario that does happen. I love the question, but this is a good example of where when you're taking a chemically fabricated product like garlic powder or garlic salt, onion powder, onion salt, and they add stabilizers to it, it could very well be some of the stabilizers. We didn't talk about that in the panel I showed you, but there are actually like gums that are additives and things that certainly your body can be responding to, and not necessarily the garlic or the onion. That's why I usually tell people, you know, eating the stuff that you eat from the perimeter of the grocery store is probably the best way. Go with food that's natural. What are the main causes of low motility? Well, there's a lot of causes of low motility. I can't give you a main cause, but I will say that, you know, just not drinking enough water is a possibility. Having a candida infection can certainly cause that. So iron, too much iron, taking iron supplement, there's a number of things. This might be one of those things where you might want to get a 15-minute consult so we can get a little bit more information. Are cheeses the same as milk? Very good question. So cheese has a different protein than milk, but we usually test them. And so it can be a problem. If you are susceptible to cow's milk, you're more than likely going to be susceptible to cow cheese. However, the more aged the cheese is, usually the less problematic. The softer the cheese, the more problematic. Goat cheese usually is completely different entity altogether. So I definitely recommend to my patients that if we find that you're sensitive to dairy and cheese, I usually recommend that you would do goat cheese if you need to do that. How do you heal a leaky gut? Great question. So first, we have to make sure that we've cleaned up everything that's causing the damage. And then once we've done that, we can use a couple of different products, something called L-glutamine and butyrate. These are definitely different things that we use specifically to rebuild. How often should you get a food sensitivity test? I've gotten one through AMH, but should I plan on needing it again in the future? Great question again. So I have only, and I tell people, yes, food sensitivities should be done once we know what you're sensitive to. Unless you have a super leaky gut and everything shows up, we shouldn't have to do it again. But if we have a lot of sensitivity, we then have to kind of cherry pick what we're going to be focusing on and then see if we can get the symptoms to improve. And then if the symptoms have improved enough, then we don't really need to look. But if the symptoms haven't improved, we might want to look again. I had a food sensitivity done 13 years ago for myself and came up with several different things that I was sensitive to. I've avoided them for the last 13 years. 2 years ago, I started having this really interesting response, and garlic became my problem, mainly because I was over-consuming it. And you can create a food sensitivity, like I said, just by over-consuming. The description I use is if you had a mosquito bite and you itched it for 5 seconds, no problem. For 5 minutes, probably still no problem. But if you itch it for 5 days, you're really going to cause a lot of damage. So the more that you reintroduce foods that you might be slightly intolerant to, and as you keep reintroducing them, you keep making a bigger hole. And so sometimes you need to retest. In my case, I was overdoing garlic and then found out that garlic, and that's a terrible one because garlic is the mainstay of just about every cuisine known to man. And so it made it very difficult for me to go out, and I had to get rid of it. That's for sure. Those are all the questions that I have. If I haven't answered your question, like I said, you can reach out to Aligned and get a free 15-minute consult. I'd be happy to entertain free consultations with anyone. All you gotta do is call and say, I heard Dr. Buffard and I want to get a consultation with them, but there are several other providers that can offer that to you. Thank you again for joining us. I hope this has been really informative. I appreciate your time. Have a great day.